A coroner has highlighted the lack of specialist care for patients with ME following the death of a 27-year-old young woman. Maeve Boothby O'Neill died of malnutrition in October 2021 after suffering with ME, also known as chronic fatigue syndrome. She suffered for over a decade. Maeve had been admitted to hospital several times that year and spent the final months of her life confined to her bed, struggling to eat or drink. This week, following the inquest into her death, the coroner, Deborah Archer, wrote a Preventing Future Deaths report outlining not only that NHS care for ME was non-existent, but that medical training was extremely limited and research budgets inadequate. She said if action isn't taken, more will die. Well, Maeve's mother, Sarah Boothby, joins me in the studio now. Sarah, thank you so much for coming in.
Thanks for having me here.
Let's start with this bright young woman here, Maeve. Yeah. Tell me about her, because she was more than ME.
Yeah, a lot more. And she was my only child, right? So I have nobody to compare her with in terms of being a mum. But she was a dream daughter in all sorts of ways. Yeah. She was so keen to learn and so independent and imaginative and kind. And that's quite a rare combination. And as she grew older and matured into adulthood, all of those things kind of became stronger. So her thirst for understanding and learning and knowledge just increased, but she'd acquired more, so she knew more, so she knew how much more there was to learn and wanted to learn. And she was very kind. For example, she was in agony when she was in hospital, but we were still being tested for COVID. And so every 3 days had to be a COVID test. That was making her worse, but she never refused a COVID test. She refused to have her vitals taken because they weren't critical. They would always come back, there's nothing wrong with you. And that's the real problem with ME in this country. We treat it as if there's nothing wrong, which obviously can't be true because she died. She didn't want to die, and she hated dying. I mean, literally. She had found a way to live with chronic illness and was very courageous in that. She knew that going into hospital would make her worse, but she went in 3 times.
Because she couldn't eat. She was too weak to eat or even take on fluids. So
she couldn't chew, right? She couldn't get... So one of the things that happens with ME is that you ask your muscles to do things. I want to stand up, and you just can't do it. It's just not there.
Because these symptoms started at around 12 years old. They noticed in PE her legs would just go.
Yeah, so she had... we both had the same virus when she was 12, and it seemed that we'd both made a full recovery. Okay.
Just get over a virus, so she did bounce back.
Absolutely, she was really active, happy person. Really motivated too, you know, and talented, so that she'd won music scholarships at her school, for example. So, you know, she'd be doing music in addition to all of the lessons that she always got A stars for. And then at 14, the PE teachers, she'd fallen down a few times before that, but the PE teacher said, sorry, you're going to have to sit out of all of our lessons because it's not safe.
And that was the first proper indication that something wasn't right.
Yeah.
It took a few more years and a lot of fight from you and Maeve to get a diagnosis. And then, with the spirit you've just told us about that Maeve had, she wanted to seek help. She actively sought treatment, help from medical professionals. What response was she getting?
She was being offered a treatment programme that didn't work. And she was very funny about it. As I said, she was very independent for me, so I discovered a lot of these things after she died. And I read some of the correspondence between her and the GP, the specialist GP for chronic fatigue syndrome. And she said, the specialist says, I promise you, if you follow this programme, you will start to improve. And Maeve wrote back to her and said, tell my legs that. Because it didn't... I mean, she'd had the same symptoms for years, and they were only increasing. She wasn't getting better. She wasn't afraid of exercise. Exercise, if you've got ME, is really dangerous for you. And
that is what's recommended by the NHS. It's interesting, isn't it? Because Maeve was a clever girl. Yeah. Physically, she was debilitated, but mentally she was still sharp.
Never debilitated,
So she found herself knowing more than the medical professionals she was seeking help from. And
yeah.
this came out in the coroner's report because they're saying, you know, care, specialist care within the NHS is virtually non-existent. What was it like to watch her go through this, actively seeking help? Because as she said, Maeve was very clear.
Yeah.
She wanted to live.
Yeah, very clear. And the only way, I have tried to find a form of words for this, and I can't do it. I've thought so hard about it, like 3 years every day. What the heck is going on here? And the only thing that I can think of that begins to describe it is, it's like the Emperor's new clothes, you know, the fairy story. It's like everyone's looking and they're saying that he's wearing these beautiful clothes. And then there's this one child who can go, but he's naked. Why can't everyone see what I can see? And then the other thing that happens with ME is that Maeve's not the only one. She's not the only one to have died. She's the only one to have got this amount of publicity. But she's only got this publicity because she knew that death was a possibility from medical neglect, and she asked to be neglected, to be protected from that neglect before she went in to hospital, before she went in.
Because she saw it coming.
Because she knew what the risks to her were, and nobody else saw that.
Maeve wrote an essay around a year before she died, and I just want to read a little bit of it because it gives you an insight into what a sharp young woman she was, fighting for herself, and now, after her passing, fighting for others. She said, "I've been tied since I was 13. I cannot adequately describe how frightening it is to find at 18 that the only treatment which medical professionals are offering you, the only treatment there is not working, does not work, and that you are getting worse, not better. How frightening to discover that there are no doctors who can help you, that they do not even know what is wrong with you. I had every potential to be an asset to humanity and hoped and intended to advance the cause of human flourishing." That is what not just your family have lost, but we have all lost in this lack of awareness, understanding. And from your point of view, you can tell me about this willingness to engage in improving care and research for those suffering from chronic fatigue and ME.
Well, there is so much to say here and we haven't got all night, but this is where I'm really horrified by what has happened, is that Maeve died 3 years ago. The inquest opened immediately. It has found nothing that we did not already know before Maeve went into hospital. No progress has been made, apart from with the Royal Devon University Hospital Trust, that has designed a treatment for ME, specifically for ME, which is only safe for patients with ME. And they have asked 3 times for NHS England to commission this so that everyone else in the country can have access. I know that there are people all over this country right now facing exactly the same situation that we faced, threatened by it with exactly the same suspicion and disbelief as we experienced. And why on earth would the NHS not commission that service to prevent deaths? The only thing it's going to do is to prevent death from malnutrition. There's a lot more that can be done. You don't have to let it get so bad.
So there's this one hospital trust doing the work, and it's the hospital trust that failed Maeve. They are trying to right the wrong.
They have learnt from her death.
But other hospital trusts are not taking it on. Listen, we've only got 30 seconds left together, and I want to give you that final 30 seconds.
Thank you.
What do you want to see happen? Because the coroner said inaction means more people die.
Yeah, no, people are dying right now. I know they are, because I know some of these families personally, and they deserve to be protected from that death by a health service which is supposed to be there for you at the point of need, and they need it now.
Sarah, thank you for coming in. Thank you for talking to us about Maeve. I'm so sorry for your loss. She sounded like a wonderful, wonderful young woman.
She really was.
And I really hope that this interview tonight and more that you do will catch the attention of those who can really make a difference, because this is so important to not just your family, but so many other families around the UK. Thank you.
Thank you. Thanks for the opportunity.
Thank you. Sarah Boothby there, the mother of Maeve Boothby O'Neill. Well, a spokesperson for NHS England gave us this response. Our thoughts remain with Maeve's family. They go on to say improvements are needed within the health service and across society to increase understanding and awareness of ME and to make sure that patients and their families are listened to and receive the care they need in line with NICE guidance. We will continue to work closely with the government, patients and clinicians to achieve these ambitions, including carefully considering the concerns set out by the coroner. A spokesperson from the Department for Health and Social Care said this: "Our deepest sympathies are with Maeve's family and friends in this tragic case. Every patient deserves to have their condition understood and treated to the highest standard, and this is a heart-wrenching example of a patient falling through the cracks. Maeve and her family were forced to battle the disease alongside the healthcare system, which repeatedly misunderstood and dismissed her. It's important that we learn the lessons from every prevention of future deaths report, and we will consider the report carefully before responding appropriately. We are committed to improving the care and support for all those affected, and we intend to publish a final delivery plan this winter, which will focus on boosting research, improving attitudes and education, and bettering the lives of people with this debilitating disease."